Hello, everybody. I have 5 o'clock, so I'm gonna go ahead and get started. Hello. My name is Karina Peterson, and I am a second-year medical student here at NEOMED. I am today presenting for the NEOMED Script Your Future Patient Education webinar series. And I just want to thank everyone for coming out. Script Your Future is a patient education webinar series that focuses on, or is a patient education kind of platform. It's a student-led campaign here at NEOMED and kind of nationwide that focuses on ways to improve patient medication adherence and outcomes in the community. And it also aims to improve upon and help manage various health problems. So today I am going to be talking about eye diseases. So first things first. So the title of our presentation today is Eye Conditions Associated with Chronic Disease. What are they and how can we manage them? So our objectives for today are first to understand the fundamental parts of the eye, second to discuss diseases that affect the eye, and third to summarize treatment options for various eye diseases. So we'll get into some of these throughout the presentation. So to just kind of set a basis for the whole presentation, the anatomy of the eye can be quite confusing. And so I just wanted to give a very basic overview of what the eye looks like so you can better understand some terms that I'm going to use later in the presentation. So first, the cornea is the first part of the eye in which the light comes through. As you can see, it's on the picture, it's on the very far left. It'll say cornea kind of in the bottom left corner of the picture. And this is where the light first comes through. And oftentimes, because of misshaped cornea, things like that, you can have a different eyeglass prescription. So that's just one of the many ways your eyeglass prescription can change based on the shape of your eye and among other factors. So second part of the eye, kind of looking at that big green half circle, it's called the iris. So the iris changes shape based on the amount of light coming through your eye. So as you have heard, maybe their eyes are wide with fright. So sometimes when you're scared or in a dark room, your pupils get super big and dilated. Or if you're out in the bright sunlight, you may notice that your pupils are really small. So what actually changes is the shape of the iris when you change your light situation. The third part of the eye is called the lens. So the lens changes shape depending on how far or close you're looking at an object. So when you look kind of closer at an object, your lens is going to get a little bit bigger. And if you're looking a little bit farther away, it's going to thin out. Third, the retina is part of your eye that sends information to your brain and takes light information and sends it to higher brain centers through the optic nerve. So the optic nerve is really the part of the eye that relays all of the information to your brain so that your brain can make a full picture. And the retina is the part of the eye that allows you to see it in general. And the retina, as you can see kind of on the side, it has a lot of blood vessels. And so those blood vessels, unfortunately, are a cause of a lot of issues in the eye. And lastly, the macula allows you to see in the center of your vision. So when you're looking at something straight on, you're really using your macula. And if you have any questions, please put them in the chat and I will try to get to them if I see them. So moving on, so the first thing we're going to talk about, so what chronic diseases can cause problems in the eye? So first and foremost, diabetes. Second, high blood pressure or heart disease. Third, high cholesterol. And fourth, COPD. So in today's presentation, we're going to talk about diabetes, high blood pressure, and high cholesterol, all affecting all chronic diseases that can cause problems in the eye. We're not going to touch on COPD because there is not a huge strong link, but we're going to talk about the first three here today. So first we're going to talk about diabetes. So diabetes-related eye conditions are also called diabetic eye disease. So there are four major ones. So the first one is diabetic retinopathy. The second one is diabetic macular edema. Third is glaucoma, and fourth is cataracts. So as you can see on the left in these images, I know they're kind of small, I'm sorry. Diabetic retinopathy has to do a lot more with your retina. Cataracts has to do with the lens of your eye, and glaucoma has to do with the pressure inside of your eye. And on the bottom left, you'll see a picture of a cataract in somebody's lens. Oftentimes it looks a little bit glossy or glassy if you're looking at somebody's eye. And then on the bottom right picture, you'll see an image of what your optic disc looks like if you have glaucoma. And like I said, we'll get into all of these in a minute, except diabetic macular edema. So first, I want to talk about diabetic retinopathy. So there are two kinds of diabetic retinopathy. The first kind is called non-proliferative diabetic retinopathy, which is generally considered a less advanced form of disease, versus proliferative diabetic retinopathy is considered a more severe form, where the tiny blood vessels in your eye start to leak and can cause pretty significant vision loss. And I'll show you an image of that in the next slide. But first, some facts about diabetic retinopathy. So it is actually the #1 cause of blindness in the United States. And as you can see on the top right, the prevalence of diabetic retinopathy is actually growing due to more people having diabetes and kind of an aging population. So these are all reasons that we are expecting more people to have diabetic retinopathy by 2050. So there are no really early symptoms of diabetic retinopathy. You may notice a slight blur in vision, but the really only way to check to see if you have it is by an eye exam, an annual eye exam, looking at your retina. And in terms of people who are at risk, this is generally just a summary. Just diabetic type 1 and type 2s are both equally at risk to develop this disease. And if you have a timely diabetic or timely eye exam, you have a 95% risk or reduced risk of vision loss long term. So next slide. So this slide, we're going to talk about diabetic retinopathy vision and progression. So on the left, you're going to see a picture of a normal retina and then a picture of a retina with diabetic retinopathy. So as you can see, on the left picture, on the right one, where it's underneath where it says diabetic retinopathy, you can see there's in the retina you get hemorrhages, which are like basically little explosions, as you could say, of blood. You get little aneurysms, and all of these negatively affect your vision. And your vision can look like on the bottom right of the screen, eventually if it gets pretty severe. So on the right, it kind of just walks you through what the progression of the disease looks like. So in the beginning, you could have little to no symptoms, but they would maybe potentially visible on eye exam, where it says DR1. DR2, again, maybe a little bit of symptoms. It's still non-proliferative, which I said is considered a less advanced form of disease. In the DR3 category, it is still non-proliferative, but you still have significant hemorrhages, maybe some aneurysms, and you're going to have some blind spots and maybe a decrease in sight. And in the DR4 section, it says you have a lot of blood in your eye and you may have significant vision loss, maybe even worse than that picture on the left. So it is really important to have a yearly eye exam just to make sure you're not getting any early signs of the disease, and in which case it is slightly treatable. We do have some great treatment options available. So are you at risk for diabetic retinopathy? So nearly 40% of individuals with diabetes have evidence of diabetic retinopathy if you are over the age of 40. Like I mentioned earlier, people with diabetes type 1 and type 2 are at risk. And there was a recent study that showed that compared to individuals with a hemoglobin A1C of 6.0 to 6.5, individuals with an hemoglobin A1C value between 7 and 7.4 have faster progression and worse visual outcomes in this disease. Also, as we'll get into in a second, co-occurring high blood pressure, which is generally considered greater than 120/80, accelerates the risk for diabetic retinopathy. But also, like we mentioned earlier, so early improvements in diabetes can slow the progression of eye involvement. So lowering your blood sugar after you find out diabetes or you have diabetes, or managing it really well can slow the progression, and you may never progress to those more advanced stages of the disease. So on the left, you can see some risk factors that can be controlled. So like I just mentioned, reducing your blood glucose levels. So making sure your blood sugar is on track. Second, also making sure your blood pressure is on track. And as we'll get into in a little bit, we did talk, there have been several webinars on how to control blood pressure, all about blood pressure. So there's some helpful tips in there. Also controlling your cholesterol levels, controlling your weight, and reducing your smoking are all things that can help prevent your risk for more severe diabetic retinopathy or a diabetic retinopathy in general. Unfortunately, there are several, as research has been developing, there are several community healthcare screenings that happen for diabetic retinopathy in the case that you can't make it to your annual eye exam. Because there's so many people expected to get this disease in the next 20 years, there are a lot of community efforts to kind of prevent and check up on people to make sure they're not getting it. So are there treatments for diabetic retinopathy? And the answer is yes. First and foremost, blood sugar control. So more stringently, they recommend a hemoglobin A1C level of less than 6.5. Generally, less than 7% is acceptable. But like I said, more stringently, people like to see 6.5. There is laser therapy. It's called laser photocoagulation. And it's useful if there is macular edema, which means if there's fluid in your central vision area. This can be helpful in non-proliferative diabetic retinopathy, so the less advanced form of disease. And injection therapy is also another treatment. The treatments are called anti-VEGF therapies, and they reduce the amount of new blood vessels that develop in this disease. And there are very good visual outcomes in patients with proliferative diabetic retinopathy. So going back to our diabetic eye disease, so this is glaucoma is another part of diabetic eye disease. And individuals with diabetes are twice as likely to develop glaucoma. So the type of glaucoma they're more likely to develop is open angle glaucoma. So increased pressure inside of the eye leads to damage of the optic nerves. And as I kind of explained earlier, the optic nerves are what conveys what you see to your brain, so you can understand the images that you're seeing. And in the case of open angle glaucoma, this can lead to blind spots and tunnel vision later in the disease. So yes, but open angle glaucoma is not to be confused with closed angle glaucoma. Closed angle glaucoma happens very quickly and is a very painful condition. And it most often occurs when the pupil quickly opens. So if someone goes from a super bright light to a super dim light, it can kind of happen that way, but there's not really a particular reason why it happens, but it is not related to diabetes. And this glaucoma can cause severe vision loss if it is not treated with medication or proper blood sugar management. In cases of severe open angle glaucoma, there are surgeries available and several medications. The medications work pretty well to control this. So cataract, this is another part of diabetic eye disease. So a cataract is a clouding in the lens of an eye leading to poor vision that can be potentially reversible. So cataract progression is significantly accelerated by diabetes, and people with diabetes are 5 times more likely to develop a cataract at an earlier age. And cataracts are easily treated with a quick operating room procedure with replacement of the lens of the eye. And the technology that replaces the lens in the eye is really cool because oftentimes your glasses prescription can be built into your lens implant to replace the cataract. So really cool stuff. So next, we're going to talk about what eye diseases can high blood pressure cause. So first, it's hypertensive retinopathy, optic neuropathy, and choroidopathy. So today, we're only going to talk about hypertensive retinopathy. So hypertensive retinopathy occurs in patients with poorly controlled high blood pressure or in short-term cases of extremely high blood pressure. Hypertensive retinopathy from long-standing high blood pressure rarely causes visual loss, but if blood pressure rises very quickly in case of a hypertensive emergency and is over 180 over 120, sorry, that should be have a 1 in front of the 20, permanent vision loss can occur if blood pressure is not quickly reduced. And in general, it can often cause blurred vision. And the picture on the left is a little bit technical, but it's kind of just showing how in case of hypertensive retinopathy, the blood vessels in your eye get really thin and can leak really easily and cause visual loss quickly if you have super high blood pressure. So what treatments are available for hypertensive retinopathy? So first and foremost, as always, blood pressure control. This includes lifestyle changes such as healthy eating, exercise, smoking, avoidance of alcohol, as you can see on the left. And if you're in a hypertensive emergency, rapid blood pressure control is the best way to preserve sight. And this link below is actually to the SYF, the Script Your Future webinar on high blood pressure. So if you want to learn more, I'm sure you can get a hold of this PowerPoint and look at that webinar. So lastly, we're going to talk about how high cholesterol affects the eye. So first, corneal arcuus is a gray, white, or yellow deposit on the front of your eye. It kind of, as you can see on this pink picture of eye symptoms, high cholesterol. On the top right, the arcuus senilis is a condition where you get deposits on the front of your eye. It kind of goes around your iris and will look maybe a little bit funny in the front of somebody's eye. Secondly, you can get exanthelma or exelasma. I'm sorry, I always have a difficult time pronouncing that, which are bumps on the skin around your eyes. High cholesterol, the cholesterol kind of deposits in those areas. You can also get a retinal vein occlusion, which is cholesterol buildup in a blood vessel, blocks off the primary vein in your eye, leading to a buildup of blood and fluid inside of the eye. And it can cause permanent vision loss very quickly. And retinal vein occlusions can also lead to macular edema, which is fluid buildup underneath the area where you get your central vision. Neovascularization, which is presence of new blood vessels that are often abnormal and can cause harm to your vision. And glaucoma, like we had mentioned earlier, which is a condition where you have high eye pressure. So how can you prevent all of these diseases? So like I was talking about in the diabetic eye exam section, yearly eye exams can help to not only catch these diseases early, but if they are treatable, you can start early treatment and be on top of the disease itself. So along with that comes management of your diabetes, your blood pressure, and your cholesterol levels. And also try to be aware of changes in vision. So if you notice you're seeing maybe a spot here or two, it's never a bad thing to go in to your doctor, make sure everything looks okay. Also, eating a healthy diet can help to prevent a lot of these eye diseases. And wearing sunglasses, so UV eye protection, has really been demonstrated to protect your eyes long term. So Script Your Future, the impact of the entire series campaign. So the Script Your Future has conducted a series of webinars on diabetes, high blood pressure, cholesterol, and heart health that all kind of bring together treatments and information and how to manage all of these conditions. And so bringing it all together, almost all of the eye conditions covered in this presentation are treated by management of the greater systemic disease. So it's so important to treat the underlying disease alongside the disease-specific eye treatment. So it may be it's equal importance or even more important to treat the underlying disease rather than just the eye. So for more information, we will put the link in the chat, so you can have more information on all of these webinars and some blog posts that we've written about them in case you're interested in knowing more. These are my references. Are there any questions at this time? If not, I just want to say thank you to everybody to help put this on. We really appreciate everybody's participation, and huge shout out to all the faculty and other presenters and Kavita and Jasmine for putting this together. They've been the biggest help. So yes, if anybody has questions, please feel free to email me and I will put all of the information in the chat. So yes, thank you, everybody.